Okay, so looking at risky use, one way to think about this, if you recall me earlier saying that um, when we're talking about um, despite continued use despite significant substance-related problems, and I said that um, for me, how I can think about it and how I try to help clients get their heads around it is just think about these as health and social consequences. Right? So we talked about what that meant. So you could think in terms of social impairment versus risky use, where social impairment is about the social consequences, risky use is about the health consequences. So um, so the risky use obviously can involve social circumstances, but it also in DSM under risky use it's specifically called out continued use despite the knowledge someone's having persistent or recurring physical or psychological problem. So this can be a couple examples of this may be someone who's on antidepressant medication and the prescriber and or you as a therapist appropriately say to them, listen, if you're using substances, particularly depressant substances like alcohol or marijuana, it's going to get in the way of and minimize the clinical benefit of that medication, if not cause you problems in terms of worse side effects or other unwanted side effects. So that could be like psychological problem, or uh, someone can have had a stroke or another type of cerebrovascular accident, a CVA, and the neurologist says to them, again, a good neurologist who might ask about substance use in addition to as part of um, their stroke recovery assessment and ongoing monitoring, they might say to that client, your alcohol use or other substance directly increases your risk of another stroke, which can be true. Uh, so, and then the person, you know, continues to use despite that knowledge, and sort of clear messaging, particularly in light of like clear messaging from a trusted provider. Or that they'll say, the provider's otherwise, got a good reputation, which again, this could be you too. And suddenly they're questioning your credibility because you're saying to them, your your use is going to interfere with this medication or cause another significant medical event. As in the case of the latter example with CVA. Um, so the key issue in evaluating this criterion, reading this right from the DSM, the key issue in evaluating this criterion is not the existence of the problem, but rather the individual's failure to abstain using substance despite the difficulty it's causing. Why do I read that to you? Because to me, and again, now this part is just my opinion, is that when you're learning in 700 about motivational interviewing theory and practicing motivational interviewing and motivational type work in your field placement and other clinical work, to me, one of the things that is most helpful is to try to help the client identify what is important to them, what are the things that are important to them in their life. And not just things that like, well, I have to have this job so I can pay the rent, but what are the things that bring them joy and outside of the substance, and to try to help them like the the substance use is robbing you of these other things that are important to you in your life. And what I want for you, what I want to help you do is get those things that you tell me you want that are important to you. And really like try to make sure that it's coming from them and not being ascribed by you. Okay. Which can be a challenge. But and sometimes they'll reflect things to you, and then or they say things to you, and you're reflecting it back. Well, this is important. Well, no, it's not that important. When people are struggling with motivation and ambivalence around their substance use. Okay, so risky use does involve social as well as health consequences. Um, but it gets a little bit more into the detail about the continued use despite health. Sorry, that's my dog. Um, if you want to see her real quick, there she is. Yes. Okay, so I'm going to end this video on risky use and see what she needs. Just a quick addendum to risky use, just to want to make sure I call this out specifically. So, a specific social consequence or health, actually, you could consider this a social or health consequence, is the use situation itself is risky. In some cases, risky in a life-threatening way. So, where might one go to purchase drugs that you can only get, substances you can only get illegally, can include situations that may be directly create direct life-threatening risk. A couple examples of this that come to mind are people who are their substance of addiction are prescribed um, opioid-based medications, and they're running out. They're running through their prescriptions. They can't go back to the prescriber because the prescriber's not going to write anymore, and they can't shop around because they're in the prescription drug monitoring system and are flagged. The pharmacists, they're flagged at the pharmacy too. The insurance company is not going to pay for an extra prescription. So they find themselves, at least in their minds, forced to go out and purchase um, either an opioid off the street or street version like heroin. Um, and one of the things that's come up in the last few years in situations like that in my clinical work is now that fentanyl, at least at the time of this recording, is my perception, infiltrated almost every aspect of illegal uh, drug, transactions, that the risk is literally life and death because someone may purchase anything from marijuana to heroin to lots of other substances that are made with fentanyl in them. They don't know it, and as you well know, the risk include immediate death. Other things that come up are people who may stay in abusive relationships because it's the most immediate conduit to the substance of addiction, or they're just left, with very little resources because they spend whatever resources, time, and money that they have on substances. So they find themselves forced into living situations or relationship situations that are abusive, harmful, and maybe even life-threateningly so. Um, the other thing that I've run into just in clinical experience are people who are involved in sex work, not for the money, certainly not because they enjoy it, um, but the main driver, and it's usually not just this, but a lot of times one of the primary drivers that keeps them in that sex work industry that they prefer not to be in, is it's the most expedient way, at least in their mind, to obtain the substances that they are addicted to. So that's just a bit of a part two on risky use.